Good morning, everyone, and thank you for joining us. We will be granting permission to record one by one, so be patient with us, please. And we appreciate your patience after you ask us for permission to record. I'm Erica Harquist, Public Health Division Communication Officer with Oregon Health Authority. And today we are providing an update on OHP Bridge and what this means for the state of Oregon. We have Dr. Sejal Hathi, Oregon Health Authority Director, Dan Tsai, Deputy Administrator and Director of the Centers of Medicaid and CHIP Services with CMS, Senator Elizabeth Steiner, and Gil Munoz, CEO of Virginia Garcia Memorial Health Center, joining us today. So a lot of great subject matter experts. As always, this is an opportunity for members of the media to ask for questions and hear from our experts. In announcing this media briefing, we provide a YouTube link normally for folks to watch, but this time around we are going to have this link for today's press conference attached to an after action press release, which we will be sending out, and folks can watch that shortly after this media availability wraps up. So a friendly reminder to please mute your audio and use the raise your hand function if you want me to call on you and add you to the queue to ask your question. And again, please speak slowly. That helps out our ASL interpreters. All right, let's get things started. Dr. Hathi.
Thank you. Good morning, and thanks to all of you for joining us. We are thrilled today to announce a significant milestone in our journey to ensure that all Oregonians have access to the physical, behavioral, reproductive, and dental health care they need and they deserve. This chapter begins during the COVID-19 pandemic, when the federal government passed legislation directing states to keep people on Medicaid regardless of their income changes. In Oregon, this resulted in tens of thousands of previously uninsured individuals suddenly gaining coverage, people who historically had had the highest rates of uninsurance and were more likely to delay their care due to costs. We know that these higher rates of coverage are associated with better health outcomes, with greater healthcare access, and with fewer health inequities, and we want to keep it that way. So starting today, a new benefit package called OHP Bridge is available to help keep these people covered. This is a benefit offered by the Oregon Health Plan, and it will cover adults with higher than previously allowed incomes, eventually roughly 100,000 people. OHP Bridge will bridge the affordability gap between those with traditional Medicaid and those with marketplace plans, and help mitigate churn due to income changes. OHP Bridge is free. There are no monthly premiums, no costs to see a doctor, and no copays or deductibles for covered services. While 2 other states have established programs like this, only Oregon's is at no cost to all members. This means that more people will be able to get the diagnoses, treatment, and other services they need, preventing delays in care that nearly 300,000 Oregonians otherwise report due to costs. Oregon is also the only state to formally engage tribes in the development of its basic health program. We heard loud and clear from the 9 federally recognized tribes in Oregon that maintaining the same coverage for American Indian and Alaska Native members that others on OHP had is necessary for approval. So we are grateful to see CMS honor this government-to-government relationship and our legal obligation to recognize tribal sovereignty. This will also further our quest, OHA's quest, to eliminate health inequities in Oregon. Everyone deserves access to affordable, quality coverage, and OHA will continue to work to make that a reality and to set the pace for the nation in partnership with our federal colleagues at CMS. With that, I'm delighted to turn it over to Daniel Tsai, CMS's Deputy Administrator and Director of the Center for Medicaid and CHIP Services, where he leads the center in addressing health disparities and serving the needs of individuals and families who rely on these essential programs. Dan, thanks for your leadership and your participation today.
Thank you, Director Hathi. It's great to be with you all. I love that you said, I think you said tremendously excited or something of that sort. I think that very much expresses how we feel from CMS, HHS standpoint, federal administration. We're excited to be partnering with Oregon on this very innovative launch today. And I think we as an administration have focused on coverage, on really making sure that eligible kids, families, adults have access to affordable coverage without gaps. And I think Oregon has been a really innovative partner all along in helping to reduce administrative barriers that prevent eligible people from maintaining coverage. And that's included partnering on how to expand continuous eligibility for kids and for adults as well. And many efforts from the state, and I see Gil from an FQHC on the provider community advocates and helping to really keep people covered during Medicaid unwinding or the resuming over the past year of Medicaid renewals. And on this OHP bridge program that the state is announcing today, we are very excited. The basic health program, as folks may know, was established during the Affordable Care Act, really as a way to provide states an innovative method of trying to simplify and make coverage more affordable, especially for people kind of right on the cusp of Medicaid and CHIP eligibility and into the marketplace, of whom those individuals would often have changes in income, and folks would have to leave Medicaid, enroll in a health plan, go back and forth. Complicated for people, for families, for individuals, complicated for providers. And the BHP approach really helps to smooth that out. And Oregon is, as you just heard, one of just the third state that has really taken up this up with some really unique facets that I think we're really excited to see. With quite a comprehensive benefit set, without free to individuals, which is exciting. And so we're happy to partner with Oregon. And as you know, we also very much take our government to government relationship with the tribes very seriously. And so we also recently just approved a Section 1115 demonstration that ensures that tribal communities can continue to access Medicaid and CHIP services in the way that they have been, even as the state rolls out this bridge program. So thanks for having us. We're excited to support you all, and we're excited to see more coverage happen with fewer barriers and red tape. And I think I'm turning back to Erica. Is that right?
That's right. Yes, thank you so much, Dan. We appreciate your partnership and we appreciate you being here today. And now I'm going to introduce Senator Steiner.
Hi, everybody. I'm Elizabeth Steiner. I'm a state senator, and perhaps more relevant for this conversation, I'm a family physician. I actually came to Oregon to do my residency because of the Oregon Health Plan, and this is the 35-year anniversary of the passage of that crucial legislation that put Oregon at the forefront of healthcare innovation and ensuring access to health insurance for so many more people. And Oregon has continued that tradition for many, many years since then. The Bridge Health Plan is the next step along the path to ensuring that every Oregonian has access to high quality, affordable, upstream healthcare to both prevent disease and manage chronic disease well, so that people can live as healthy a life as possible, can be productive members of their communities, so that adults can be active members of the workforce. As Director Tsai said, we know that the people in this income range from 138 to 200% of federal poverty level are the ones who are the most likely to churn on and off of the Oregon Health Plan, of our traditional Medicaid plan. And this kind of churn, this kind of access to healthcare, no access to healthcare, access to healthcare, is really not good for people's well-being. It's stressful, it increases anxiety, it reduces the likelihood that they'll manage chronic disease as well. So I have had the privilege, I was the privilege of co-chairing the task force along with then Representative Prusak that developed the plan to move forward into what we now have as the Bridge Health Plan. And one of the reasons that Oregon's redetermination process and unwinding has gone so smoothly and resulted in so little loss of coverage is because we have committed to maintain people in this income range. So I'm very excited to be part of this, to see this part move forward, to ensure that Oregonians across the state, regardless of income, have access to high quality, affordable upstream care. And it's really great to see our state moving forward, once again being ahead of the curve, at the leading edge of the curve in ways to make sure that Oregon is the healthiest state in the nation. So it's a privilege to be here all with you, and I really thank Director Tsai and the entire CMS team for your active engagement with us over the past year or more as we've pursued this plan.
Thank you very much. And we appreciate you being here today as well, Senator Steiner. All right, well, we also want to hear from another subject matter expert. Gil Munoz has been kind enough to join us today. He is the CEO at Virginia Garcia Memorial Health Center. Hi, Gil.
Good morning. It's very exciting, and it's a pleasure to be with you this morning to talk about yet another innovative way that Oregon is helping to extend coverage to working class families. Virginia Garcia is a community health center that serves over 52,000 patients in Washington and Yamhill counties, the majority of whom are below the federal poverty level. During the last year, we assisted over 37,000 patients to maintain their coverage on the Oregon Health Plan. This extension of the Bridge program is a win for patients. Working families who are challenged to make ends meet with housing costs, with food, transportation, childcare. So providing coverage provides them relief from the stress that they face with juggling all of these critical expenses. It provides access to preventative care and is a win for providers as well who are working with these families to coordinate care, to get them into the diagnostic care that they need, the specialists, the inpatient care that they require. So it eases the path to better health and better prevention for these families. It's also a win for our cost sustainability for the community, as more covered individuals will result in less cost shift and more affordable health care overall. So Virginia Garcia, we're extremely proud to be in a state that is innovative in this way and is advancing health equity. And we stand ready with the state and Oregon Health Authority to roll out this critical program. Thank you, and I'll turn it back to you, Erica.
Thank you so much, Gil, and thank you to all our subject matter experts for joining us today. We really appreciate your time. And we are going to take reporter questions for about 15 minutes. We're going to try to wrap today at 11:30, just in the consciousness of everyone's busy schedules today. I see that Lynn Terry with the Oregon Capital Chronicle has the first question. Go ahead, Lynn.
Mute. Okay, sorry. I was trying to unmute myself. Thanks, Erica. Very quick, I have just some nitty-gritty questions. And that is, what is the cost? How much, what's the percentage dollar amount will the feds be paying? And what will be, and then about how much will the state be paying? How many, is it 230,000 fell off Medicaid? And I believe that's the number, but if you could let me know, kind of a fact check here, about how many of those people do you think will be included in the Bridge plan? And what are you telling people to do? Do they just go onto the one system and sign up? Yeah. I have some other questions, but if I could get answers to those, it would be terrific. Thank you.
Sure. So I can begin to address that question, Lynn, and then I can turn it to Dan as well. And we have some Medicaid experts on the line if you have additional technical specificity required. But in short, the basic health plan OHP bridge is a great deal for Oregon taxpayers. There's a small amount of general funds needed to assure coverage of some reproductive health services that the federal government does not pay, but close to 99+% of the costs of the basic health plan are covered by the federal government. And the program is funded, as Dan said, under Section 1331 of the ACA. And effectively, this is equivalent to the amount of the tax credits, up to 95% of those tax credits, which would have gone to individuals who purchased marketplace coverage. So we are very grateful to CMS and the federal government for their support of this program to expand access to coverage and to care for more Oregonians.
I could just add from a federal standpoint, as Sejal said, what's exciting about this from a state innovation standpoint is the basic health program statute basically says that if a state wants to run a program like this that is innovative, meets a minimum set of standards, which involve, robust coverage, they are able to access, the federal government is able to provide 95% of what the federal subsidies otherwise would be for those individuals if they were enrolled in Obamacare ACA marketplace plans. And the states are able to use that and structure things that make sense for, in this case, Oregon. And so the details of how the state uses that, as long as they meet certain federal requirements, are up for the state to outline. And so that's how the federal framework works.
Can I get a dollar amount to that? How much is this? Obviously, you guys have done all the analysis on it. How much is this going to cost Oregon a year? And about how much are the feds going to pay a year? And what is it like, about 60% with normal Medicaid that the feds pay?
So Linda, we're happy to have comms follow up with you, Erica can, after this call to get you all the specifics.
Okay.
Yeah, all the numbers, and you have my email, so I'll definitely get you some more information for that. Thank you so much. I see that Peter Wong, reporter Peter Wong, also has a question. Go ahead, Peter.
Okay, can you hear me? I got a lot of background noise. For the new recipients of the bridge plan, who presumably are out of OHP, do they have to do anything, apply for anything? Are there steps that the recipients need to take? Thank you.
Can I start with this one, and then OHA can correct the parts that I'm wrong? One of the things that the state made the commitment to do, and that we provided the funding for in the last biennium, in the 21-23 and the 23-25 biennium, is to keep people in that income range, in that 138 to 200%, who will now be covered by the bridge plan on traditional Medicaid. They had been on what was called Medicaid expansion, which is a 90-10 federal state rate. We kept them with the federal government's permission on traditional Medicaid. So the state picked up about 40% of the cost for whenever they went through redetermination and were found to be in that until today, when they get moved over. So many of these people who would have fallen off of health insurance, the state kept them on to avoid those gaps in coverage, because that was critically important. Now, we know that there will be other people who were not on Medicaid, who are in this income range, and there will be outreach, as Gil and others have alluded to ensure that they're aware that they can enroll through the one eligibility system in this program. But up till now, we've done a really good job ensuring coverage by picking up an additional percentage of the cost to keep them on the Oregon Health Plan, to avoid that churn and those gaps in coverage.
And if I may just add on briefly, we do have a team of eligibility outreach specialists, at all of our sites, who are working with our patients to ensure that they are covered under these important programs that are offered. There's a lot of movement that people need to be aware of, that we help them navigate the system so that they can be qualified and enrolled.
And I'll just add that really starting today, people in Oregon can visit our One System or use healthcare.gov to apply for OHP bridge coverage. People with marketplace plans will not automatically move to OHP bridge today. If someone with a marketplace plan is eligible for OHP bridge, they can keep their coverage and financial assistance under their plan until their automatic re-enrollment period ends. We are expecting, though, to just add to the senator's point that just between 28,000 and 30,000 individuals will be transitioning over today, and these are individuals for whom we had received federal approval to keep them on their traditional Medicaid coverage during and after PHE unwinding.
For that question, Peter. I see that there is a question from KFF Health News, and we will get to you, Philip, as well as you, Daisy, with KGW. But first, Raymond Rendelman, go ahead.
Oh, thank you. There's been a lot of talk about moving people over from the traditional plan to this new bridge plan, and we're wondering what the differences are between the two plans in terms of specific health coverage provided. Like, is there still going to be dental coverage provided under bridge as there is under the traditional plan currently? And are there any other differences between the two plans?
So OHP Bridge will cover medical, dental, and behavioral health care. Members will also have access to additional benefits like rides to appointments and health-related services. Unlike some Medicaid plans, OHP Bridge will not cover long-term services and supports. It will also not cover the health-related social needs that we are rolling out under our 1115 waiver.
Thank you, Dr. Hoppy. I also want to acknowledge verbally Christina's question about providing the exact numbers that we're also going to be giving to the Oregon Capitol Chronicles. So yes, we did see that, and we will be sending that to everyone. We'll track that down. Okay, Philip with KFF Health News, you had some questions. Go ahead.
Yes, thanks. Can you hear me?
Yes.
Okay, great. Yeah, I just wanted you become, I believe, the third BHP following New York and Minnesota. And I was just trying to find out what makes your program maybe a little different, unique. It seems like the one thing is that you will have no premiums and no copays. Right now, New York also has no premiums, but I believe they have some copays. I'm wondering if you guys can elaborate on what you think separates you from the others, or if anybody else on the call can do that.
Sure. So I have some thoughts here, but I want to turn to Dan, who has the national landscape view, and ask if you want to chime in first.
Yeah, I think that's correct. From a national standpoint, Minnesota and New York were the two. New York has now actually transitioned out of a BHP into a 1332 piece. Similar, just slight variations through a waiver, but and Oregon is now the third state. One of the most notable features of the Oregon model is certainly no premiums and no cost sharing. I would also note the Oregon benefit package is quite comprehensive, looks very similar to the full Medicaid coverage, which is beneficial for folks who might be moving back and forth between Medicaid coverage and the bridge plan.
How important is that? Is the no cost sharing? How big a leap is that to help people?
So I think maybe the state can answer it from their perspective.
Maybe I could start and just say that we know that cost sharing in any form, whether that's premiums or co-pays, is a barrier to care for people in this income range. And were we to have either or both of those, we would actually see decreased access to care, which is counterproductive for the goals of the state. We thought about this hard as part of the task force last year. All of those meetings are recorded. You can find them online if you're curious, but we had significant conversations about that. And the data are really clear that any kind of cost sharing reduces access to critically important care. And ultimately, Oregon's experience running the Oregon Health Plan for so many decades has created cost efficiencies. Our partners with FQHC, like Virginia Garcia and others, have helped us streamline the process in ways that make it so we believe that we can manage this program solely on the funds coming from the federal government, with the exception of administrative costs, and the reproductive health care costs, which have to be covered by the state, as Dr. Hathi alluded to. So I felt very strongly, as did others in the task force, that any kind of cost sharing would be counterproductive, and we were going to do everything we could to avoid that, to reduce barriers to care.
And cost sharing also disproportionately harms the most medically vulnerable populations, those that are targeted, who suffer from both historical and contemporary forms of injustice. And so addressing that component in our design of the basic health program of OHP Bridge, we also felt was foundational to our strategic plan to eliminate health inequities in Oregon.
Thank you for that question, and thank you so much to our experts for the answer. It looks like we are getting close to 11:30, but we have one more question, one more reporter with a question in the queue. Daisy with KGW. Go ahead, Daisy.
Hi, Erica. Thank you so much. And I'm hoping this is going to be a really quick question and an answer to it. I'm a little curious on the timeline from when folks will be applying for this new plan, and how quickly will they apply and then get insured?
So we are transitioning folks to the basic health plan, to OHP Bridge, beginning today. And our teams will be working as fast as possible to facilitate enrollment and transition over the next several weeks, months, and years, especially for those that are transitioning from marketplace plans. But I wonder if Nikki from our Medicaid leadership team wants to chime in with any additional thoughts.
Yeah, happy to do that. Good morning, everyone. Nikki Olson, Deputy Medicaid Director. Just in a more level of detail, so people who are found eligible for Bridge on or before the 15th of the month will have benefits starting the 1st of the next month. And if they're found eligible after the 15th of the month, benefits begin the 1st of the following month. So that's just kind of on a very specific technical level, and we'll be, as we've mentioned, we'll be transitioning people actively starting now. Who have already been on traditional OHP who qualify. Really quick.
Great, thank you so much, Nikki. Nice to see you as well. And it does not look like there are any more reporter questions, and it's 11:30 on the dot. So as I mentioned at the start of this, in case you missed it, we are going to be sending out a after action news release with information, and we will track down that specific data that seems everybody now wants. So we'll include that information as well as a link to this press conference on that press release. So you all have my email. Reach out if you have any follow-up questions. And I want to thank all of our subject matter experts for your participation today. And this is exciting news for the state of Oregon. Thank you all today for being here. Take care.